tell us about how you became interested in sleep.
So yeah, with sleep, um, I think I really started to, I've always been really committed to sleep. It was the one thing I never gave up as a student. I always made sure I got enough sleep. So it really wasn't until I had a bike accident in 2014 that
Mhm.
I finally was struggling with sleep. I had post concussive syndrome, and it wasn't easy anymore. So that kind of made me think a little more about sleep, because I used to only really, when patients told me they were struggling with sleep, that's when I would ask them more about it, or we might track it as an activity of daily living, something that we wanted to improve throughout care together. And then I guess it's at 2018. So when we switched to electronic records at the clinic, I wanted to change my intake forms for new patients and integrate them into our record system. And so I actually, I really liked the form that the Ordre des Chiropracticiens had. And they actually asked about how many hours you were sleeping and how good your sleep is. Because I'll admit, I didn't ask everyone about it. So then I started realizing that nobody sleeps enough. um, like to a really high degree, it was kind of shocking. Like I was really blown away with how little people were sleeping and how little they cared about that. Like it just wasn't really in their radar at all. And that was just an observation, I would say, probably for the first year or so until I started talking more with Cheryl about sleep, is I would just kind of observe silently that nobody was getting 7 to 9 hours of sleep, right?
Right.
So since I've been asking a few more questions when we were in session in our first our new patient appointment, people don't know. They really don't know why we would want 7 to 9 hours of sleep a night, or even especially with moms and new babies. I think some, unfortunately, parents, like, their sleep cycle is different from a baby's, and they don't appreciate. It's getting better, I would say, but they don't necessarily appreciate that for a baby that's normal, even if really frustrating and really hard to live with as a grown adult. Um, and now as I try and get people to talk more about sleep or address sleep with them as kind of a core or like foundational, a part of the work we do together, there's a lot of resistance there. I'm really noticing that thing,
Right.
right? Like I think I mentioned, well, you'll hear later. They're like, well, I'm fine on 6 hours. And I'll say, well, but are you really?